Welcome to the Healthcare Hot Seat with Tina D. Badham and Lorie D. Owens, where the people who keep healthcare moving and the people who depend on it finally get a seat at the table. Take your seat. The conversation starts now.
Welcome back to the Healthcare Hot Seat. I'm Lorie Owens.
And I'm Tina Badham, and today we're talking about something most people in their 20s and 30s, and maybe other ages as well, quietly avoid until they absolutely can't, and that is health insurance.
It's not because they don't care about it, but because no one ever explained it in a way that feels normal or doable.
So we're going to do just that. Straightforward, real language, no shame. Here's the truth. Most young adults are trying to build a life, pay bills, and stay healthy, and insurance kind of feels like this extra layer of confusion that they didn't really ask for.
And the system does not make it easy. You think you're covered, then the bill shows up and you're like, what just happened?
So let's break it down in a way that actually helps.
Let's start with the emotional part, because it isn't just about paperwork. It's about feeling lost in the system that assumes you already know the rules. Because this is not something we teach in school. It's not anything anyone learns other than just experience, right? We learn through our mistakes. And there is no shame in asking these basic questions. If you are at work and signing up for the first time, ask human resources when you don't understand what the plans are, what the cost is, how that's going to impact you.
Yeah, absolutely. There definitely is no shame in that. I mean, do you remember the first time that you realized you didn't actually understand your own insurance?
I actually I can remember not having health insurance because one, I couldn't afford it,
Yeah.
and two, I didn't think I'd ever get sick enough to even worry about it. Young and healthy, what difference does it make? What do I need that for? And then there was an accident, and suddenly, uh-oh, no health insurance. Now what?
Yep.
And those are real world problems. I mean, you cannot predict being in a car accident or tripping and falling.
Nope.
A whole host of things can happen, and that's what health insurance is there for,
I think we talk
not
about
just
that
being sick.
across. Yeah, and we talk about that across the spectrum of all insurance, right? Like
Yes.
auto insurance, home insurance, like you don't need insurance until you need it. And then it always seems to be when you do not have it, that's when something inevitably is going to happen because it's going to be cost and it will be way more costly and a lot more stressful.
Absolutely. So, why do you think many young adults feel embarrassed to ask for help with this, Tina?
You know, I think it's not knowing what they don't know, and we say that a lot in a lot of our discussions, you don't know what you don't know. And
Mhm.
I think they feel like, and this is probably not entirely untrue. You mentioned it a few minutes ago. It's a system that already assumes that everybody understands the rules. It is based on the fact that everybody should understand those rules. And like you said, we don't teach this in school. And as a parent, even somebody who's been in healthcare my entire life, I never thought to sit down with my daughter and explain to her specifically what each individual part of healthcare was, or, every health insurance policy out there, because, I probably just figured it all out myself. And so I assumed that she would do the same. And that's really kind of a dangerous assumption because it's not the way that it is. They do go through without understanding it. And I'll never forget the first time that she went to urgent care and she got a bill back and it was like $300. And she's like, what is this? Why do I owe this much? Because the reality is that you think that it's only going to cost you like a copay. Everybody seems to grasp copay, right? We all understand what that is.
Yes.
But there's so many different things that go into insurance, like, and we'll talk about those in a bit, but like co-insurance and those other things that you also have to pay. And then you have the scary parts where you have a provider that's not in network, but the hospital, it can get very tricky. So I think the best thing for us to do here is to simplify the things that determine how much you actually pay. And that starts with your premium. Okay. So your premium is what you pay every month or every paycheck, usually is how it's set up to have insurance. The
Uh-huh.
deductible. Your deductible is what you pay before your insurance actually picks up and starts paying anything. And you have to be
And that's an annual thing,
yeah,
right?
absolutely. It is an annual thing, and you have to be careful with that because some insurances you go and you select it based on your premium because you're like, "Oh, well this is going to be the smallest amount out of my paycheck." But then you have like a $10,000 deductible, meaning every time you go to the doctor, you're going to pay the full amount of that until you meet that deductible. So it can get very tricky and there's a lot of misunderstanding there. And that brings me to coinsurance, of course, what I just mentioned. Coinsurance is where you've met the deductible and now they are going to pick up and start paying, but you still have a responsibility. Generally, I can't say generally because every plan's different, but in my plan, for instance, it's 80%, 20%. So my insurance will pay 80% and I'll pay 20% of that until I meet my coinsurance or the out of pocket max, which is the other term that we have to talk about. And that is the most amount that you will pay in a given year. And you have to watch it because some of them can be very high up there.
They can, and not all out of pocket max includes your deductible. So
Nope.
that's another piece that you've got to look at and ask questions. So,
Yep.
which one of these do you think trips people up the most, Tina?
I think it's pretty much everything outside of what they're not paying out of their paycheck. If I'm being totally honest, and I say that because I was a 20 something once, all I cared about was I don't want them taking $160 every pay period out of my check, you know? What is this stuff? I don't care about that. And like you said, until you get that bill, right? Until you have that
Mhm.
accident, until you receive that medical bill and you think, holy cow, like now I wish I would have been paying that $167 every 2 weeks. So I think really that's where they trip up the most is outside of those. I mean, what about you? Do you kind of agree with that or do you think that there's other pieces?
No, I do think that that is a huge part. The other part is the difference between in network and out of network. It's very
Mm,
confusing to someone who's never been exposed to that and understanding that they can't go to just any provider that they want to. And some
that's it.
plans are built with open networks and others have very specifics. And it really impacts whether or not you have a copay or deductible, because we have our PPOs, right?
Yep.
And those PPOs allow you to have lower copays and lower deductibles if you're using their in-network providers
Right.
versus out of network where you end up again in that 80-20 situation or maybe worse.
Right.
Um, and you have a
True.
deductible to meet where, um, so I think that is a big part of confusion. And then, we have urgent care and sometimes we look at that as the better first stop instead of going to the ER because it's definitely a lot cheaper.
Yeah. And probably a lot it's a little less intensive too. Like they're not going to do as many tests. And there's certain things that urgent care can't. Like if you're having a heart attack, obviously urgent care can't
Right.
help you. But I think you brought up a really good point there and that's the in network and out of network stuff. If you go to a hospital specifically, and I know both of us have seen it and I'm sure there's probably a lot of people out there that have, you'll get a bill from the hospital and you get a bill from the provider that you saw in the hospital, and those two don't have to be in the same network. And if they're not in the same network, you'll pay your normal deductible coinsurance, that kind of thing that you'll have for the in network hospital, but for that specific provider, you're going to pay a higher rate because they're not considered in network. And that is a scary thing. And most people are like, it's so unfair. And they're not wrong. It is unfair because there's no transparency with that. It's not something that's told to you when you walk in that ER. You sit down, they're not
Mhm.
saying, oh, hey, by the way, your provider is not in network. Instead, what they do is a blanket agreement that everybody signs without really reading, right? Because
Mhm.
let's just be honest,
Yes.
especially when you're in your 20s. And in those situations, I think you're focused on your emergency. You're not focused
Yeah.
on what you're signing. And so, in that fine print, though, it actually does say that you will probably and most likely receive a separate bill from the providers and any other people that are consulted in your care.
Yes.
That's the other part. So, you see the provider in the emergency room. If they have to call, let's say I go in with some kind of cardiac issue, well, they get on the horn with, cardiac doctor upstairs I'm also going to get billed from that cardiac doctor. There's so
Mhm.
much that goes into this that can make it so confusing. I think this could be such an expanded, amazing episode because there's just so much that goes into it. But kind of bringing it back a little bit, Lorie, there, what do you think is the easiest way that you have found to explain deductibles to somebody who is new to all of this?
Oh, wow. Um,
Yeah. It's tough. Yeah.
it is tough. I don't know that I've actually explained it to somebody before, Tina.
Well, let's take it
Other
this way.
than, like, more so at work, right?
Yeah.
When I've had to talk to somebody about their bill when
Right.
they've gotten a bill that they think is a big surprise because they didn't read the paperwork that we gave them that said you have a deductible of
Yeah.
$200 and then you have 20% copay, which we estimate to be X number of dollars. Because we're also required as providers
Yeah.
to inform our patients of what their potential costs are. Um, and so that's something to consider too as a recipient of care, is to know that you should be asking, what is my expected expense for this? Any provider should be able to give you an estimate up front, and make sure that you ask so that you understand and you do not get surprise billing. And there is legislation around that too,
Yeah.
to protect you as an individual. But I think the easiest way to explain it is what we already said. It's the dollar amount that you have to pay every year before any care is paid.
Right.
It's just the simplest terms, and it's going to reoccur every year.
That's right.
And there is some care that is paid for, that, such as on those PPO plans or those HMO plans, and you're going to see the doctor for your wellness visit. Those types of visits are usually not part of your deductible.
Yep.
You're just going to pay your $20 copay or whatever that dollar amount might be, and it's not going to count towards your deductible. And so that's the other thing to think about, is that those dollar amounts don't count towards deductible, but they will count against your out of pocket.
Yeah. It's I think it's such a web, isn't it? And I think we
Yes.
definitely will have to have another conversation specifically when it comes to talking about Medicare and those replacement plans, because a lot of this can apply to that also. And there's a
Oh, absolutely.
lot of
Absolutely.
confusion when it comes to that. But I think one thing that I kind of want to talk about with that, and I think you have the best explanation that I've ever heard for it. And this is kind of a little bit not necessarily geared towards the younger people, but for those elderly people in our listeners that are looking at those Medicare replacement plans. Let's talk about those
Mm.
for a minute. I know your thoughts, and I have adopted those thoughts based off of the things that you've told me. But why why would it really be something that you'd have to really think about and consider when it comes to those Medicare Advantage plans?
Wow.
Yeah,
You know, that's a loaded question there, Tina.
I know.
But I think, I think about so many of those plans. For one, they differ by state. So if you are in Virginia, you're in Florida, your options are not the same.
Right.
And that goes from your Medicare replacement, it goes to the prescription plan. All of your options are completely different. So that adds to the confusion for our growing population of older folks, and who is actually choosing some of those plans. You live in New York and you retire and you're on one plan, and you decide to go down to Florida and you have a whole new opportunity to select a different plan
Right.
with different providers.
And we've heard
But
of people
yes,
moving specifically to get those plans.
yes, my best friend
Yeah.
actually left here and went to Florida to get a specific
Yeah.
drug plan. And she ended up coming back here, but now that she's
Right.
locked into that plan, she's good to go.
Yeah.
But it was a big life change for her. And the other thing to consider is that those in-network plans, because when you
Yeah.
switch from that traditional Medicare, everybody is not open to you anymore.
No.
And some of those plans have surprising deductibles and don't cover quite necessarily the same things that Medicare does in the same way.
Yep.
And there are good things about that and negative,
Yeah.
right? So, for example, in home health, Medicare pays 100%,
Right.
period. In some of these Advantage plans, you might have a deductible. You might have a copay for those home health services. Your durable medical equipment, the walker that you need, the hospital bed, all of those things become different. Not necessarily in a bad way, but you really have to consider exactly what your health is. And
Right.
I actually just had a conversation with my sister because open enrollment was a few months ago, and we were talking about how this she had new health situations. And so how did that impact her choice? And so we went through all the plans again. She went through with her insurance agent
Yep.
who was helping her make a decision, and had to do a lot of research. And the other thing to consider is when you sign up for these Medicare Advantage plans, don't just look at your health today,
Right.
because today at 65, you might be very healthy. You're not taking any medication. Maybe you're on some cholesterol meds, and that's it. And you're doing great. And that's wonderful. But you have to consider the things that can happen, and what your potential is to develop certain disease processes, and make sure that you are making those decisions annually,
Absolutely.
not just that one time.
I think
So
it's
sorry, I went down a
no,
rabbit hole
I
on that.
wanted to. No, I wanted that. That's important. And I think it's an important topic. My dad called me back like the last couple of weeks of September. And he's like, I know it's time for open enrollment. He's kind of newer to that. And we decided that for him that Medicare standard, traditional Medicare was the way to go for him. And he had to get a drug plan, of course, additionally, because Medicare
Mhm.
doesn't have that coverage. And so it does cost a little bit more out of pocket, and for him that works out. But I on the flip side, you have my grandmother who's been on an Advantage plan, multiple of them for a while, and she loves them because they give her all these like dollar amounts that she can spend at Walmart and other places. Like
Yes.
there are a lot that have attractive features like that. But one thing I will say about a couple of the ones that she's been on, and I won't say this about all of them, but it's that preferred provider, like we were talking
Mhm.
about before. She'll have a doctor, she's set up, and then in the middle of the plan year, that doctor decides they no longer want to be associated with that particular insurance. So now she's left to find another physician, or she can continue going to see the same one, but she's going to pay that out of network amount, which ends up being a lot more than what it would be if she were just on Medicare. So I think again, it really is tricky. And I think sometimes they can be a bit misleading. They can get some phone calls from some of these different companies that are not necessarily the most reputable, and they'll
Mhm.
promise them things and they'll tell them this and that and the other, but they forget to mention some of those, latter, what do we call it, fine print aspects of
Yes.
those plans. And then they're stuck with that bill when it comes around. And I think that with traditional Medicare, I think one advantage to that for me is there are no surprises with that. Most everybody takes Medicare. You know what you're paying going in. It's not going to necessarily change on the dime like that, for a good example there. But
Yeah.
and again, I think the Advantage plans are great, and I think there are some that will work really well for people out there. But again, like you said, I think it's best to look at your situation and think about the future sense and what's going to work out best for you in that case, not necessarily what you're looking at when you're actually signing up.
Yes, absolutely. And there's a great website. And I'll have to get you the site, Tina, but you
Yeah,
can
yeah, put
actually
it on.
shop those plans and look at the differences between the plan options that are available in your area.
That's
Um,
fantastic.
so you definitely want to make sure that you're doing that.
Yeah, and
Um,
And to tie it back to the younger generations as well, like when you're looking at in your benefit pamphlet or book or whatever it is that your employer has given you, or if you're shopping online for it yourself outside of an employer, I think what Lorie said earlier stands, and it's so important and imperative that you ask questions. Don't just assume that you know.
Mhm.
Your HR person is the top advisor on that. They know those plans, they've selected those plans for your particular workplace. And if you're shopping online, speak to the people that are there. Do the comparison shopping. A lot of them will let you check boxes and compare plans right there on the screen. So I think, again, don't feel like any question is a dumb question. Always ask, because it's better to ask than to get stuck with that crazy bill. And,
Absolutely.
yeah, and we're talking about crazy bills, and I know, we're talking about insurance, so I want to throw this out there as well because we do have some international listeners as well. I had a family member who came over on an international insurance plan. We had international travelers insurance. We thought we were covered. And this, again, is coming from somebody who's been in healthcare for a long time. I felt like I had read through most of what was in there. Well, it turns out that this particular family member ended up having really bad pneumonia and they were hospitalized. And they were hospitalized here for about a week and a half, 2 weeks here in the US. And so we're thinking the whole time, great, travelers insurance, we've got it, it's covered, it's all good. Well, it turns out they connected that pneumonia to a prior COVID infection, which then took it out of coverage for that particular insurance that we had selected because it was considered a prior event. So again, it's about that fine print. You got to read it. So she ended up getting a bill, no joke, $46,000 for the time that she was in the hospital here in the US. And it's kind of insane, and we were lucky because the hospital that took care of her, they were a not for profit and they were able to kind of help with that, and we are so grateful because that is a very hefty bill. Not no
Absolutely.
normal person, I cannot think of any person that I know personally that could just go hand over $46,000 for a health insurance bill. I just can't imagine what that would even look like. I'm sure there probably are people, but personally, I couldn't do it. We couldn't do it. And I'm really grateful to the hospital that they were able to help with a lot of that. So, I think it's scary when you think about that because and this goes into like a whole different territory, and we're definitely going to have to talk about that universal healthcare versus American systems because we found out a lot of things. It's wild the things that you find when you actually have those situations kind of combine. But I think if there's one thing that I learned from that situation, it's that even knowing what I know about it, you have to read that fine print. You've got to make sure that whatever coverage you're choosing covers you for the entirety of what could potentially happen, even if that is the more expensive option up front, because you just never know what this
Mhm.
life is going to throw at you.
You do not. And you brought up self-pay,
Yeah.
or having to pay out of pocket. And so I just want to touch on that for a moment because that is something that I find often happens in particular with prescriptions, right?
Yes.
They are astronomical. And and this doesn't matter, whether you're 20 something and getting a prescription
Yeah.
or you are 80 and need your Eliquis, whatever the case may be, there are options. So just think about asking more questions when you go to get your prescription filled. So, for example, some medications, the copay is actually higher for you than if you ask for cash pay pricing. And you've probably seen William Shatner on TV talking about the drug plan,
Yeah.
that's, a discount drug plan, which is free to sign up,
Yeah.
but there are quite a few of them out there now. And you can use those discount plans in order to have cash pay pricing. And a lot of times it is cheaper.
Yeah.
I keep bringing up my sister, but um, she got prescribed a medication that was like $6,000 a month. So her copay was going to be like 200 and some dollars. And as it turned out, we were also fighting for authorization. So in the meantime, I said, hey, what's the cash price? The cash price was $150 for an entire month's supply versus the 200 and some dollars she was going to have to pay for a copay.
That's
So
insane.
it
Yeah.
is insane. And that gets me down another rabbit hole about prescriptions, but
We love rabbit holes here. Do it. Let's do it.
but well, let's I want to finish this up.
Yeah.
So ask questions. Again, we talk about this on the show to stay curious, stay informed, and stay in the hot seat, but
Yeah.
really stay curious. Ask the questions. There is no stupid question, really.
Mhm.
The
No
only
such thing.
stupid question is the one that wasn't asked. Um, you've got to stay educated about your health care, about your decisions that you're making, especially those that impact your financial and health care.
Yeah. And I think too, you brought up a good thing too. I think also when you're looking at those things that you've got the prescription cards that are out there available for people to do also, and a lot of people don't know this, sometimes the drug maker themselves offer discounts if you just research it a little bit. My
Mhm.
father was on a medication that he had to take. It was super expensive, and he was still on private insurance at this point. He had not switched over to Medicare. And we were able to go through the manufacturer themselves to get that prescription for $25 as opposed because there was at this point there was no generic for it. There was no such thing as a generic for this drug. So the cost, even cash price, was going to be astronomical. So going through the maker, now of course in that case they were only offering it for people who had private pay insurance, but you never know unless you look. There are some that offer it even for those people that are on Medicare. And another thing too with that is if you're on Medicare or Medicaid or any of these government assisted programs, you can also fill out a lot of times what they call like income verification through them. And sometimes they can even get it down to free for you. So never just take whatever the pharmacy tells you immediately as like law. You've got to research that. And I love that you threw our little slogan in there as well, because the reality is we say that for a multitude of reasons, but the truth of it is you cannot stay informed if you don't stay curious. All of that ties together. So you've got to ask those questions.
Yes, you do. And we do ask our listeners to share their experiences, not to
Yeah.
laugh at them, but to show the commonality that we all have and the confusion that is really around some of these situations.
Yeah, absolutely. I think, everybody has that thought process of, hey, we're, looking at the unexpected bill that we received or anything along those lines. But I want everybody that's listening to us, if you forget everything else that we've said, remember these five things. They're going to help you to save money and to save that stress. And that's to check your in network every time. Know your deductible. Use urgent care when it's appropriate. Ask for that cash pay pricing, as Lorie talked about. It really is a game changer in a lot of in a lot of circumstances. And keep your explanation of benefits, those EOBs that everybody gets from the insurance company. And I know for the longest time I was equally as bad about just ripping them up and getting them out of there. But they are really important and really key because they tell you, hey, this is likely what's going to happen. And a lot of times the tests that we're having done and the things that we're having done, a lot of them require pre-authorizations, and you're going to get that EOB before you ever actually go to have those tests. That EOB is
Mhm.
going to tell you what to expect when you actually go to have those tests done. So super important there. Really important that you guys remember that.
What of those would you put at the top of the list, Tina?
Oh, um, I think I'm going to be a little surprising here. I think all of them are equally important, but I think using that urgent care when it's appropriate, because this is something that I think a lot of people don't necessarily understand. And if you ever watched any of those shows on television, like The Pit, The Pit is really great. It's a brilliant show. I have really enjoyed watching that, and I think it has a really good. There's some really good stuff in there, but one of the main things that they talk about is how you know oversaturated it can get in the emergency room. And if
Hmm.
every person goes to the emergency room for, I don't know, like a small pain or a sore throat or a cough, and I'm not saying that they don't have their place and that it shouldn't be used, but in those circumstances, if it is not truly an emergency, it should be a last resort. You should take it to urgent care because it keeps those emergency rooms open for the people who are having those medical emergencies, like that, somebody's father who's having a heart attack. that they can get in the door and be seen. And again, I know they're really good about priorities and that sort of thing, but it also helps your family. If I take my daughter to the emergency room with strep throat, for instance, or she has a sore throat and she's just not feeling very well, and we're sitting in the emergency room, one, I'm exposing her to who knows, untold amount
Mhm.
of germs and other things. And two, we're going to sit there probably for hours because we'll fall to the bottom of that list because ours is not an urgent situation. It's not emergent. So they're going to take those emergency cases before us, those women that are in labor, those people coming in with heart attacks or pulmonary embolisms or whatever else could be going on. They're going to take those as priority, and they should, because the priority should be getting those that are the most life-threatening back there. But I think urgent care is a great option, and a lot of people, I think, seem to overlook that. So for me, that's what I would put at the top or the priority of that list. I don't know if you have something different there, but I feel like that's an important one.
No, I think that's a great one. We did a segment recently about emergencies and calling 911, and that is one thing my husband says all the time. He's like, we get called for, you know, things that they should be going to urgent care for.
Yeah,
And it then texts the system for those guys as well. If you're having to call 911 and really you're having something that could be handled by urgent care and you could get a ride or drive yourself, like taxing the system and taking that care away from somebody else
that's right.
it can be very detrimental to someone else. So just thinking about those, but also recognizing, we talk about this um, before about recognizing your anxiety. Is
Mhm.
this, a true
Yeah,
emergency? Take a deep breath. Think about this. Where is the best place for me to get care?
right.
What could this be that is not necessarily the worst case scenario? And where's the right place to get care?
I once
Uh,
had a friend tell me, and actually haven't spoke to this friend in a really long time now that I think about it, but they used to say all the time, well, the best thing to do is just call 911. They'll take you in the ambulance, you'll get right in. And it's like, yeah, you're right. They will take you right in because you come from the ambulance bay, but that doesn't mean you're still not going to have a wait. As soon as they get
right.
you in and they determine that it's not emergent, you're going to be sitting
Mhm.
there like the rest of everybody else. Like you might be in a room, but you're still going to be there. And when you go to bigger places, I had to take, we were in New York, and my husband, he had a little bit of a heart thing going on. It wasn't emergent, thankfully, but we didn't know that at the time. We just knew that there was some stuff going on with his heart rate. And so we took him, and I'll never forget this, walking in there, like there was just people lining everywhere. He was literally on a bed in the middle of the hallway because they didn't have enough room to put people in rooms. And I think again that kind of it drives to that, like you really don't want to go to the ER unless you have to, unless you really feel that it's an emergency, because it oversaturates it and it increases everybody's wait time, it increases cost, it decreases the effectiveness of what they can do within those walls. So I think it's overall seek the right care.
Yes.
That's a good point. So
It is the right point, I think.
yeah,
And, just a reminder, you're not supposed to know all these things
no.
automatically. You're learning, and that's okay. We all are.
That's right. There's no shame in it. No, there's no judgment. And especially here in our space, which is why we definitely ask that you reach out, give us your stories and your information, because you deserve clarity. You deserve care that makes sense. And everybody has to start somewhere. And even if that is just on some podcast that you've barely heard of, but is growing fast, just want to throw that out there. That's okay. We're happy to have you here. And in the meantime, make sure that you guys are following us on all the platforms. We're on Insta, we're on Facebook, TikTok, any of those. We don't want you to miss out on future episodes. And make sure to share this with someone who needs this conversation, who is also trying to figure this out too.
And until next time together, stay curious, stay informed, and stay in the hot seat.